Okay. So once again, I just want to say welcome. I'm so excited to be here with you all today, sharing space in this Zoom room. So thank you for being here for our November session of Community Health Learning Collective. This will be our final session of 2025. We are not meeting in December. We typically skip that month just to kind of have like a end of the year rest reset. But we will be back in 2026 in January. I believe most of y'all got that invitation that went out for our January session. But for 2025, this will be it. So we are super, super excited to welcome back Summer Al-Zawawi, who is a return speaker. She is a public health practitioner who works as the Program Director of Public Benefits Access at the DuPage Federation on Human Services Reform, which is in Lombard, Illinois. So we're thrilled to welcome Summer back, and today she's going to be sharing some knowledge and information about Social Security benefits. So very excited for that. And Summer, I will pass it over to you. Thank you.
Hi, everyone. Good afternoon. Thank you for having me again. Just a second to share my slides. And as Maureen mentioned, today we'll be going through understanding Social Security benefits, a quick overview. Going into details about this benefit will be taking more than an hour or two, as we have many benefits that Social Security Administration offers. We will be mentioning a little bit more about specific cash benefits that are available and work programs specifically that could assist you specifically more with your work and if you're working with clients that could be eligible for these types of benefits. So a little bit about our organization, the Federation, DuPage Federation. So we do offer trainings in public benefit access and also language access resource center. So the language access resource center provides interpretation and translation services and also provides training for those who are bilingual to become trained interpreters. So if you or any of your staff members are fluent in another language and are interested to go through this training program, which is 80 hours, you can reach out to me and I'll connect you with our senior program director for that specific program as well. Before we start with the main material, I just wanted to provide some acronyms that are very important when it comes to Social Security benefits. I will try my best to spell out acronyms as much as possible during my presentation. However, it is very nice just to know some of them just in case if I forget and just mention the acronym very quickly. So the main three that you might hear a lot during this presentation, which is SSA, Social Security Administration, SSI, Social Security Income, SSDI, Social Security Disability Insurance. Other acronyms that are important specifically are SGA, Substantial Gainful Activity. We'll go into detail about what this means. CDR, Continuing Disability Review, and IRWA, Impairment-Related Work Expenses. Other terms that are very important related to benefits in general are, of course, IDHS, which is the Illinois Department of Human Services, HFS, the Illinois Department of Healthcare and Family Services, and some benefits that they do offer. We are providing these acronyms because many Social Security benefits are related to them because many clients that are receiving SSI or SSDI are also receiving these types of benefits at the same time. So we'll be going through Social Security Administration, the programs they provide, cash, work programs, of course, and types of assistance and resources available for you all. So in general, Social Security Administration. So the website is very basic to everyone. So this is not only for Illinois, of course, this is for the nation as wide. You also can use this website to order a replacement for your Social Security card if you lose it, for example. You can use this also to log in and check your status if you have applied for any benefits through Social Security Administration, such as SSI, Social Security Income, or SSDI. So applying for benefits, you cannot apply online. However, you can access the forms that you do need to apply for these types of benefits. So unfortunately, Social Security Administration is still using paper applications for main benefits. Some you can do some aspects of the application online. However, they mainly do use paper applications, and they also mainly communicate through mail. You can also use the website to get a benefit estimate, meaning you can use one of their tools to see if you or your client could be eligible for a type of benefit. And if you are, what amount or what is the benefit amount you could be eligible for. So what programs that could be included under Social Security, or what programs that the funding of Social Security can fund in general? Of course, retirement insurance, survivors insurance, we have disability insurance. We'll be going into some details about these in a second. Hospital medical insurance for the aged, disabled, and those with end-stage renal disease. Some prescription drug benefits, extra help with Medicare prescription drug costs, supplemental security income. We have special veterans benefits, unemployment insurance, some types of public assistance and welfare services that are actually administered by IDHS and HFS, such as TANF, the Temporary Assistance for Needy Families, medical assistance, maternal and child care services, child support enforcement, family and child welfare services, food stamps, energy assistance, and many more. When applying for Social Security benefits, many immigrants or non-citizens are eligible for these types of benefits. Not all, however, some would be. When it comes to eligibility for benefits in general, we look into something called qualifying status or unqualifying status when it comes to non-citizens. So qualified non-citizens or immigrants could be eligible for Social Security Administration benefits if they are meaning qualified non-citizens category, or meet a condition that allows them to become a qualified citizen to get SSI specifically. Who is considered a qualified non-citizen? They are LPR, which is lawful permanent residents, green card holders specifically, that had that status for at least 5 years, meaning they had to have meet something we call the 5-year bar, or have been in the United States for at least 5 years. Also, non-citizens with humanitarian or other special statuses, such as refugees and asylees, Cuban Haitian entrants, certain abused immigrants, their children and or parents, certain survivors of trafficking. We have active duty military or veterans, their spouses and or dependents, and other non-citizens that could be eligible, such as we have Afghan humanitarian parolees specifically that have entered the United States after 2021, and Ukrainian humanitarian parolees. Unqualified non-citizens, meaning non-citizens that are not qualified for Social Security benefits and also federal benefits in general, meaning any benefits that are funded by the federal government, which include undocumented non-citizens. It also includes individuals who have applied for asylum, however, have not received the asylum status yet. We have lawful permanent residents, green card holders who have been in the United States for less than 5 years. Temporary statuses, so anyone who has a temporary visa, meaning after a certain amount of time, they need to leave the United States, such as student visas, tourist visas, and we have something called U visas, which are specifically for a certain type of trafficking survivors. So as we've mentioned, non-citizens could be eligible for Social Security Administration benefits. However, there is a time limit for them, which is a 7-year time limit for non-citizens. So qualified non-citizens can receive up to 7 years of Social Security income. Mainly, non-citizens cannot receive SSDI, which is the Social Security Disability Insurance, because they did not they don't normally have enough credit. Normally, to receive SSDI, you have to have already like enough credit under FICA, which is the Federal Insurance Contribution Act, meaning that you have been paying taxes uh, for Social Security for a certain amount of time. So because non-citizens normally they're new into the country, um, and have not applied for citizenships yet, they would not mostly be eligible for SSDI, again, because they don't have enough work credit for that. So in most cases, when it comes to Social Security Administration, non-citizens are receiving SSI if they are eligible. So these qualified non-citizens can receive up to 7 years of SSI, Social Security income. The benefits would be cut if these non-citizens do not become U.S. citizens within those 7 years. So within those 7 years, they are receiving SSI. They have to have already applied for citizenship and or in the process of receiving citizenship. So if they do meet the 7 year limit and have not become citizens, to keep receiving their benefits, they have to provide proof that they have already submitted in the citizenship application. So Social Security in general has two types of cash benefits, which is the main focus of today's webinar. We have Social Security Insurance, which is RSDI, the Retirement Survivors Disability Insurance. It mainly focuses on those who have been paying into the system for many years, specifically when it comes to retirement. We also have Supplemental Security Income. So in general, Social Security Administration works like as an insurance system, meaning the more that you pay into the system, the longer you would be receiving the type of benefit, or the amount of money that you would be receiving would increase once you are eligible for it due to disability or meeting the retirement age. So qualifiers for Social Security insurance RSDI specifically. So first of all, you have to have sufficient Social Security earning credits and also be a United States citizen or one of the qualified immigration statuses we just went through. You have to also meet an age criteria for retirement, which is 62, or have a surviving dependent or spouse of wage earner survivors, or disabled and are unable to do any work, which is disability, which the RSDI comes from, Retirement Survivors Disability Insurance. So for survivors specifically, it's important to know, so those who have been paying into the system, FICA, which is again the Federal Insurance Contribution Act, the taxes, which is normally taken out of your income when you so when you get the paycheck, normally when you look into taxes that you've been paid, FICA is one of them, or Social Security normally is one of them. So that's especially where the money is going to. So for survivors, if a spouse is married to someone who has been working and paying taxes, and that spouse passes away, their children under the age of 19 could receive their benefits. And the spouse can also receive benefits as well if they have children under the age of 16. Yes. And when it comes to disability, so when it comes to disability, those are specifically for those who do not meet the retirement age, however, have a disability or a disability happened that made them unable to work for at least 12 months. Of course, they have to have already have acquired many credits, mostly 10 years worth of credits. There are some exemptions we'll be going through in a minute as well. But normally, those who are disabled, if they have been working to the system, they could receive RSDI as well. So this is a very quick example about FICA taxes and Social Security insurance. So in a paycheck stub, normally you have federal withholding, Social Security, Medicare, state disability insurance, and state withholding. These are the types of taxes you normally see taken out of your paycheck. So normally pay stubs do show deductions, and Social Security or FICA are the deductions related to the credits that we've just mentioned when it comes to SSDI benefits or RSDI benefits. So SSI and SSDI, which is the Social Security Income and Social Security Disability Insurance, are two cash programs that are provided by Social Security Administration. They're both considered a type of insurance program. It provides monthly income for individuals and workers who have become disabled and to certain family members. So when it comes to SSI, the Supplemental Security Insurance, it provides monthly income for individuals who are 65 or older, who are blind, disabled, and have very limited income and assets. So SSI normally do not require credits, uh, credits or work credits in general. It depends mostly on need. While SSDI, you have to have already accumulated quite a number of credits. So the main two differences between SSI and SSDI, as you can see on the screen, again, SSI depends on need. So those who are low income and have very limited resources and also living arrangements. However, SSDI eligibility is mostly based on insured status, FICA payments. So supplemental security income, the monthly amount is actually based on a federal benefit rate, which could change from year to year. So for 2025, currently it's $967 per month. The amount of money could be different depending on how much money the individual is making. If they're working and making some money, the amount they receive per month will most likely not be $967. It would be a little bit less. However, for SSDI, the monthly amount is based on earning histories, how much they have been paying. For SSI, the date of eligibility is based on protective filing date and application date, meaning when they have applied for this benefit. However, for SSDI, the date of eligibility is based on something we call date of onset or of disability, meaning when the disability happened. What is the date that this disability, like let's say the cause of disability is a car accident, the date of the car accident would be the date of eligibility. For SSI also, the type of health insurance related to would be Medicaid, because it is because again, the SSI depends on need and low income. Many that are receiving SSI most likely are receiving Medicaid. However, for SSDI, the health insurance related to it would be Medicare, because many of them are either have met the retirement age or have a disability, and that makes them eligible for Medicare. So for supplemental security income, again, I just wanted to show the how much an individual could be getting per month when it comes to SSI, which is $967 a month, compared with last year, which is $943. So for 2026, there could be a difference as well. So for a couple that is eligible for, meaning both of them, the couple, the individual and their spouse are both eligible for SSI due to disability, for example, they could be receiving up to $1,450 per month. There are some resource limits for you to be eligible for this benefit, meaning an individual has to be making less than $2,000 per month when it comes to jobs and also any other resources they could be receiving. If it's a married couple that is applying for SSI, they have to be making less than $3,000 per month for them to be eligible. This number has not been changed in a while, because as I've just mentioned, that normally the amount of money they could be receiving per month could be different from year to year. However, resource limits have been the same for many years. You can go ahead, Marie.
Yeah, thank you. I'm sorry to interrupt. I just wanted to ask a question real quick to make sure I'm getting it. So for this SSI, the person must be either 65 or older, disabled, or blind, and they also have to meet the income and resource limits. Is that correct?
Correct.
Okay, thank you.
Yes. Yes, for SSI, they have to meet the income and resource limit, of course. Compared with SSDI, those are for people who have been paying in the system for a very long time. So that is like a type of insurance for them. There are some limits to it as well when it comes to income. However, I couldn't find an actual resource that gives you like how much actually they could be making and still have SSDI. But for SSI, they are straight to point about the amount of resources they could be earning at the same time. They for them to be eligible, sorry. Also for Social Security income payments, so for every $2 you earn from work, your SSI payment will be reduced by $1. So while receiving SSI, you can still work, of course. However, resources have to be less than $2,000 again. However, for every $2 you earn from work, your payment will be reduced by about $1. Work includes a job, self-employment, or any activity that earns money. And at the same time, every dollar you get from non-work sources, your SSI payment would be reduced by $1, such as if you're receiving at the same time disability benefits or any unemployment payments or pensions. Also, if you live with a spouse, their income could affect your payments as well. And children on SSI who live with their parents may have their payments lowered based on their income or their parents' income. So parents' income are mostly taken into consideration when it comes to children SSI. Children could receive SSI if they are disabled. So the Social Security Disability Income, which is SSDI, to be eligible for this type of cash assistance, you have to have a disability or blindness and also enough work history. Your disability has to affect your ability to work for at least a year or more, or will result in death. If you continue to work, your condition must also limit you from earning something we call substantial gainful activity, meaning you should not be receiving enough, the amount of money should not be more than a certain amount. For 2025, it's $1,620 per month or $2,700 if you are blind. Generally, you must have worked for at least 5 of the last 10 years to qualify for disability. For people under the age of 24, may not need to have worked as long. So normally, if you're over the age of 31 specifically, you have to be working at least 10 years so that you know. However, for those under the age of 31, as you can see over here, the amount of time you can work or like amount of work credits you can accumulate could be different depending on your age. There was a comment about saving your SSI will over 2000 in the bank. Well, was the question about SSI is saving it in yes, it would affect it. So there is actually something called an ABLE account. Um, that you can, so it's a type of account for those who have a disability to save their money in, and the money you put it in that specific account would not be considered as income. There's actually a good training coming up about it in a week or two. I can send that information to Maureen if she'd like to share it with the group for those who are interested to know about ABLE accounts. There's another comment or question. If a spouse of a person receiving SSI isn't working, but they have a minor child, can the child receive SSI as well? The client will be going on SSDI in February. So the child can receive SSI if they are disabled. If the child is not disabled, they will not be receiving SSI. So SSI is on an individual base. So they would, the caseworker that would be receiving the SSI case would be screening the individual if they're disabled, how many resources as a family they make. However, the amount of benefit would be targeted for that individual. If the child is disabled as well, a separate case would have to be opened for the child. Of course. Going back to the amount of credits needed when it comes to SSDI benefits. So If you become disabled before the age of 24, you generally need about 1.5 years of work, which is equal to 6 credits, in the 3 years before you became disabled. So you can accumulate up to 4 credits per year, 1 credit per quarter. So you have to be making at least $1,810, $1,810 per 1 quarter for that to be considered 1 credit. So for example, an individual who has become disabled before the age of 24, and they have been making, let's say, 2,000 per quarter for the last 3 years. That means they have accumulated uh, 12 credits, which is actually double the amount of credits they need for them to be eligible for SSDI. If you are 24 through 30, you generally need credits for half of the time between the age of 21 and the time you have become disabled. If you are disabled at the age of 31 or older, you generally need at least 20 credits in the 10 years immediately before you have become disabled. There's another question. When did they start the alternate savings so you will not be penalized from saving? Are you asking about the ABLE account? Uh, so the ABLE account is only for those who have disabilities. Um, they have a disability. You have to be, not everyone is eligible for that type of account. I don't have all of the details about it because I'm pretty new. I've actually heard about that from an IDHS court caseworker. They did suggest it to a client that was not eligible for Medicaid and was only receiving Medicaid spend down because of how much savings she had. She was accumulated her SSI payments in her savings account, and she accumulated around $15,000, which made her ineligible for Medicaid. So the caseworker at that time actually recommended the client to open an ABLE account because they don't look into that account as a resource when they are determining eligibility for benefits, not only for Social Security income, but also for IDHS benefits, such as Medicaid for those who are disabled or older adults over the age of 65. Okay. So moving on to work incentives. So those who are receiving SSI and SSDI can still work. However, there are certain rules about how much money they can make and still be eligible for the benefit, of course. So work incentives in general also help you to keep benefits while you try to work. So there are certain programs that are under Social Security Administration that you can participate in to learn some work skills or to earn money and still be able to keep your benefits. So one of the very important terms to know is something called SGA, which is substantial gainful activity. So what is SGA? It's for someone to be able, meaning that someone is working and making a lot of money, of course, which is why we are trying to, if we do participate in work initiatives, um, or if you want to receive SSI or SSDI benefits, you have to make sure that you are not making a lot of money, which is substantial gainful activity in this case. So to be eligible for disability benefits, a person is not able to engage in SGA. Income earned has to be below the SGA thresholds. So for 2025, non-blind, for someone who is not blind, for them to still be eligible to receive SSDI benefits specifically, they have to be making less than $1,620 per month. And for blind individuals, they can make up to 2,700 per month and still not be and still be able to receive benefits as these amounts are not considered SGA. So one of the work initiative programs is something we call Ticket to Work. So this is specifically for people between the age of 18 to 64 who are receiving SSDI or SSI. Because of their age, 18 to 64, meaning they are receiving this type of benefit due to having a disability, of course, not due to age. Um, So this type of program provides services to help you find and keep work. To participate with these type of programs, you have to contact an employment network or call the ticket call center, which is on the screen as well, or to go to the Access to Employment Support Services for Social Security Disability beneficiaries who want to work. So the ticket to work would help you to find an employment, keep that job, and also be able to receive your SSI or SSDI benefits. So what should I do if I go back to work? Meaning if you are receiving SSI or SSDI benefits, and when you did apply and you received your benefits, you were not working at that time. While you're receiving benefits, you decide to go back to work. What should you do in this case? First of all, any changes that are happening to your case, you have to report it back to SSA. This is not only about work. This also includes any address changes, any um, changes within the household. Anything else have to be reported back to Social Security Administration. So you have to also report when you start or stop work. So if you have been working, if you stopped working for any reason, you have to report back to them. You already reported work, but your duties, hours, or pay have changed. Meaning, let's say you have been working 10 hours per week. However, you increase your hours to 15 or 20. That change has to be reported back to Social Security Administration with the new with your new income, of course. You start paying for expenses that you need for work due to the disability. Any expenses that you're paying extra, you can report it back to Social Security Administration. It would also help you to receive maybe more money from SSI specifically, as it would be considered deductions.
Summer, those income limits that you just mentioned, someone was asking if that was per individual or per household.
So again, SSDI and SSI are the person who is receiving the benefit is the individual. However, they screen income for a household.
Okay, so that's household.
So
Okay,
if the spouse is working, their income would be considered part of the income.
good to know. Thank you.
Yeah, of course. Not only for Social Security Administration benefits, even benefits such as cash, food, Medicaid, with IDHS, even if one person is receiving a benefit, they normally look into a household as a whole, how much money they're making. There's only one program that does not look into the household income, only to an individual's income, which is family planning program or family planning presumptive eligibility, which provides some type of primary care, STI, STD treatments for those who are not eligible for Medicaid due to income or immigration status. That's the only program I can think in general in Illinois that looks into individual income instead of household. But in general, when it comes to all benefits, they normally look into a whole household. Okay. So there's something called a trial work period, which is currently for 2025. These are specifically for individuals that are receiving SSDI. It allows you to work for 9 calendar months. They do not have to be in order. And during that time, work will not be used to see if disability has ended. So normally, if you are receiving SSDI and if you are working and receive um, more than $1,160 per month, as you can see over here, this is for 2025. The amount of money could change from year to year. However, for this year, it's $1,160 per month. You can receive that money for 9 months, and your disability would not be screened again. So you only have this chance only for 9 months while receiving SSDI. So that continues until 9 months of services within a rolling 5-year period. So what happens after the 9 months? You have been working, you've been making more than $1,160 per month. So there's something called extended period of eligibility EPE. So this allows you to start getting SSDI payments again if your earnings fall below SG8. So while those 9 months of working, while receiving while 9 months of working, you would not be screened for your disability. However, um, after those 9 months, you're not working anymore. Your income went down again. It allows you to get back on SSDI and receive payments again if your income goes below the SGA limit that we've mentioned earlier. This does not apply to SSI payments. SSI payments are very strict about the resources and the work activities that an individual can participate in. So how is work counted as SGA? So there's something called an SGA determination that the SSA caseworker would be looking into. They normally look at the person's earning and work activity. They look at something called impairment-related work expenses we'll be going through in a moment. They look into subsidies, special conditions, vacations, and sick payment. Vacations and sick payments are considered payments. If you are sick, let's say you're working 10 hours per week and you called off for those 2 hours, if you have been receiving sick payment for them, those are still considered income. Any earnings not directly related to your work activity. So impairment-related work expenses, which is IRWA, short for. So the cost of certain disability-related items and services that you need so you can work, meaning that um, SSI, SSDI, the cost of certain items that help you to work, such as, let's say you need a cane, you need a wheelchair, or you need any other medical devices, these will be considered into a type of deduction and would be subtracted out of your SGA. So while a caseworker at SSA would be looking into your eligibility, let's say you are paying for a wheelchair, you bought a wheelchair, or you bought a cane, or you need a subscription to a type of device to help you with your disability to be able to work, those amount of money would be deducted from your SGA. It does not count an income again. So requirements for this, which is the person with a disability must pay for the items and services, meaning if the person with a disability has received the wheelchair as a gift, that would not be considered as a deduction because they have not paid for it. Items or services must be disability related. So all of the items they have been receiving and want to deduct it from their SGA has to be related to their disability. It shouldn't be something just to make their work easier, not related to disability. Um, I'm thinking of an example. Let's say someone has a disability, they're unable to walk, they need a wheelchair. However, they bought glasses because they liked how it looked like and claimed it as part of the the reasons are like Blu-ray glasses, let's say, for example, for a computer, that would not be considered a device they need for their disability. It could be used for comfort, however, not to help with their disability. Cost must be reasonable, of course, meaning if a wheelchair costs $2,000, they cannot claim it's like $4,000 or $5,000, for example. Um, Many examples to this would include like an attended care service, service animals, medical devices, wheelchairs, respirators, etc., regularly prescribed medical treatments or therapy, and many more. So anything that helps to manage their disability. Subsidy and special conditions. So the employer pays more than reasonable value of actual work done, and a third-party job coach paid by vocational rehabilitation agency. So these are the subsidy and special conditions, which is one of the things we've mentioned earlier that would be deducted from SGA, which is substantial gainful activity, which means if the employer is paying more than the reasonable value of actual work done, or if you're being paid or paying for a third-party job coach to help you to learn a job or something specifically for those who have a disability. So if you are working, you have to report your work activities back to Social Security Administration or to SGA, which is substantial gainful activity. You have to provide information about when you started working, and the information about your job, such as employer, work schedule, how much money you're making, and how frequent you get paid. Information about Iowa, which is the impairment-related work expenses, which is the wheelchair expenses, for example, the subscriptions, the therapy, and if the employer provides any extra help. Copies of all of this have to be provided with the report, such as pay stubs, receipts, any expensive. And if you receive Social Security, income benefits will stop if you earn over Social Security income limits, which is over $2,000. So if you're receiving SSDI or SSI, when do your benefits stop? So SSI normally stops if you're earning, of course, over the $2,000 limit that we mentioned earlier, the resources, or for $3,000 for a couple. Or your earnings are 3 times more than the SSI benefit amount. Meaning if you're receiving, let's say, for example, $100 for SSI, if your income is 300, your SSI benefits would be cut. For SSDI, it would be cut, for example, it would stop anytime you're making more than the amount of money we've mentioned earlier, which is actually it's 1,100 actually in 60, not 70. $1,160 per month, which mentioned earlier for 9 months. If you keep making that amount of money more than 9 months, as we mentioned earlier, your benefits for SSDI would be cut. So expedited reinstatement, this is specifically if you have been screened for SSI or SSDI benefits and your benefits ended due to you making too much money. For up to 5 years after benefits end because of work and earnings, you can receive your case can reopen again once your income goes less than the amount of money we've mentioned earlier. However, you have to submit a request. However, a screening for your disability, a screening for all of the screenings that you normally, the applications, the screenings, the information you provide during an application, you do not have to go through it. So it's a very easy request to go through. You just submit it and get your benefits back. When it comes to health coverage, Medicare coverage will continue for at least 93 months after the trial work period, which we've mentioned before. And after the 93 months, persons under 65 may be able to buy Medicare coverage, but Part A would no longer become premium free. So this is specifically for SSDI. If you have been participating in the Ticket Work program and you started making too much money, you can still receive your Medicaid coverage for 93 months after. While you're receiving your SSDI or SSI benefits for a long time, there are cases sometimes the Social Security Administration will have to do something called a CDR, continuing disability review. So normally this is done at least every 3 years or whenever a trigger happens, such as you go back to work or your income changes. So during the CDR, it depends on the type of CDR. If it's due to medical reasons, they would screen if you're still disabled, or if it's only due to income, they would screen if you're making too much money or not. So these are very short true and false statements. I'm just going to go through them very quickly due to time. So true or false, if you work, your SSI, SSDI application will be automatically denied. True or false, benefits and health insurance end as soon as you start working. You can only work part-time while receiving disability. And if Social Security knows you are working, they will say you aren't disabled. So all of these statements are false, and there are very popular myths. But as we've mentioned earlier, you can work, you can receive some type of income, work part-time, and as long as you report your work activities, you can still receive your benefits. So how can you apply for Social Security Administration benefits? So currently the application is paper application. You can access the application again online. You can screen your eligibility and see what type of benefit you could be eligible for through the website, however. How can you apply? You can actually contact the local Social Security office and make an appointment with them. Um, You can call them again to make an appointment for SSI. Why is it important if you want to apply for SSI to call them and make an appointment? Because again, for SSI, the day that you decide to make an application or you submit an application would be when you would start receiving benefits. So if you're making an application through through Social Security Administration, when you do call, make an appointment, they would be considered the appointment date, the day where your benefits are supposed to be starting. And this is what we just mentioned. So for example, a client has went to their appointment to file SSI on June 2024. They receive their approval on June 2025. The client will receive retroactive benefits from June 2024. And again, once you do submit an application for SSI specifically, it normally takes a lot of time to receive your benefits, especially if you are submitting it due to disability, not due to age. So if an SSI application is done for someone over the age of 65, and you're claiming that the reason of the application is due for a senior being low income, um, you can receive your benefits or like a decision within 2 to 3 months. However, for disability cases, it could take at least a year to hear something back. However, once you do receive a decision and start receive benefits, you'll receive benefits retroactive from the date you actually submitted an application. Where to receive assistance? Again, you can go through any Social Security Administration local office. I also added calling 211 at DuPage County. So DuPage County, their 211 number is used for social services as well. You can use that number to ask questions about how to access benefits, make a apply for LAHEAP, for example, um, or look for any rental assistance, and also to find a organization that assists with applications for benefits. There's something called SOAR, which is currently unfortunately it no longer exists on the nation. So SOAR was actually a nationwide program that was offered through SAMHSA. SAMHSA decided to close it on August. However, many states are still using SOAR. Illinois currently is not actively using it because we do not have a state coordinator for SOAR yet through SHIPA. However, many other states, if you're in another state, many other states still have it, such as Virginia, Michigan. I know it's very big at Massachusetts, for example. However, the module itself can still be used to help with applications for Social Security Administration benefits related to disability. So if you're interested to become trained in SOAR, actually the previous TA center for SOAR opened a private technical assistance like firm or something called Parkwin, and they offer the training as I think it's a 2 full day SOAR training that you can go through online. That training would provide you information about how to submit high quality Social Security benefit applications related to disability, how to write medical reports, how to um, make connections with Social Security Administration employees, and how to communicate with DDS as well. And at the end of the presentation, I just wanted to share how can community health workers assist with Social Security benefits. So, of course, it is hard for you to do an application fully with your client because to Social Security Administration benefits, specifically SSI, are very lengthy, take a lot of time to go through the application itself, requires a lot of follow-up. So what you as a community health worker can do is act as a liaison or assist with the navigation of benefits. If you're able to assist, that would be great. If you work at an organization that assists with benefits, that's great. Unless if you don't, you can actually connect your client and actually work on advocating on behalf of the client with Social Security Administration or with the organization that would be assisting with the application itself. You can identify and remove any barriers. Many that are eligible for Social Security income specifically could be homeless. So in many cases, they do not have a permanent address. And to communicate with Social Security Administration, which their main way of communication is through mail. You can help to, for example, get a PO box for the person you're helping or to get their mail sent to the organization they normally work with, um, or find a way that your client can receive their mail. Outreach and education, educate clients about Social Security Administration benefits, if they're eligible or not, help them with the screening method, and help them be connected with other resources as well. And if you want to learn more again about Social Security, you can go through their website, have some resources on SSI and SSDI specifically as well. And at the end, before I close this, I just wanted to share that we have a deep dive coming up. I'll share the link also in the chat if you'd like to register and join. We'll be going through ABE and iLogin and how to use the ABE website to submit an application on which is food, cash, and medical benefits through the state of Illinois. Thank you. Sorry, I know it was a lot of information in a very short time. That's why I was trying to go through it before looking into the chat again and answering any more questions.
Yeah, thank you so much, Summer. I think it is a lot of information. Like I know you warned us at the beginning, but the acronyms, like I get so confused going back and forth between the acronyms and then all the many rules that there are. So I think it just goes to show that like this is very needed. And also think anything that you can share with me in a follow-up, like the link for that training you mentioned, if you want to share a copy of your slides, if there's any like flyers or resources that you think do a good job of kind of simplifying some of this, I think this group would definitely appreciate that because we want to be able to help people navigate it, but it's complicated even for us.
Yes, it is. And it's hard to be connected with Social Security Administration, even when we're doing the SOAR model. It was hard. We had a connection through the SOAR model with someone from Social Security Administration. They retired and that connection disappeared as well, which is interesting. But yes, in general, benefits are through Social Security Administration is um, not as easy as compared with others.
Yeah. And Beth, go ahead. I see your hand.
Hey y'all. So I just want to let you know I work for the Centers for Independent Living, which is a statewide organization and nationwide organization. And depending on where you are in the state of Illinois, if you ever need access to somebody who is willing to sit down and do this paperwork and be able to be that advocate, Centers for Independent Living, we work solely with the disability community. You have to be disabled to receive services from us. We do this for free. My colleagues and I punch out Social Security applications, I would say at least once to twice a month.
Oh,
Um, I'm currently working with two people in an attempt to get Social Security disability right now. So remember to utilize like your community resources when you are working with consumers who may need these things. Centers for Independent Living are funded federally and statewide so that we can provide services for disabled individuals in our community. And one thing I will tell you from years of doing Social Security applications, whether it was my clinical role with Centerstone before I came to the Center for Independent Living, the questions are really wordy. Um, I think they're intentionally wordy. They tend to ask the same thing over and over and over again in a different way to kind of loop people up. And I always tell people like when we're applying, like this is not going to be an immediate thing. And then we work on finding those resources, because we were talking in the chat, like how people survive, right? How do people survive when they are trying to get these benefits, when something tragic has happened? For example, my long COVID program, I had a woman who was on a ventilator for 61 days. She came out with COPD and emphysema, 24 hours a day of oxygen. She could no longer work. She couldn't drive. She was 23 years in the school system. Since she didn't make it to 25, she didn't get her pension. There was all these things, and she ended up being evicted. She lost her home. She lost her ability to drive. She was dependent solely on us. She came to us with a third appeal. I got her set up with ALSUP because I'm not a lawyer. I'm not a disability lawyer. She was able to win her case. But what we ran into afterwards were the repercussions of it. She had an eviction. And finding housing after an eviction, I don't know if y'all work with people getting housing, it's a nightmare. So reach out to your centers for independent living. I'm going to go ahead and put the link in the chat for everybody who's in Illinois, where you can locate your local centers for independent living. But there's ILSs like me and my cohorts across the state that are happy to assist with this and help people kind of navigate what to do in the meantime, whether it be food pantry assistance or locating possible funding sources, things like that, to be able to help people. Because what I've noticed in my years of working on Social Security disability applications is it takes a while for that paperwork to process. As I stated in the chat, I gave them a telephone call last week to check on the status of something, and the pre-recorded message was 232 days of turnaround time. So, I don't know. It's never really dropped. Like it's either like in the 200 zones. I've heard as high as 287 before. So maybe they've got more caseworkers. And I feel like a lot of times like people just kind of give up on it because it's such a strenuous and arduous process. And you see folks out working when you know they're struggling through pain and they're struggling with their mental health. There's all sorts of things. So I'm going to go ahead and put in the chat, like, if you're in Illinois, where to locate your local centers for independent living. We exist solely for the disabled community, and we can help with things like this.
So
Thanks,
I
Beth.
thank you so much, Miss Beth. I had to jump in because I am one with lived experience with that with disability. That's why I was asking those questions as far as um the knowing what the money is and being penalized if you save your money and it's too much money, and then you worried about, well, how the hell am I supposed to get off my feet, even though I'm disability to a certain extent, because it's like, okay, I'm partial, not full, because that was their determination, because mine was due to an accident. And I got penalized for that because the outcome of the accident of it. And then when you the wild thing is that when you're living in the housing, and then you do work. Now you have three things you have to do. If you do get a part-time job, you got to tell housing, then you got to tell Social Security, and it's a whole roller coaster thing like this. And if you don't, they will penalize you. It is very wordy. This was I didn't have a you, Miss Beth, back 20 some odd years ago to be able to
Yeah.
do those words. That's when you saw the commercials that say, hey, get this lawyer, you get paid when I get paid. So then you have the people to do that. And then once you drop your name in, it keeps going and it takes a whole year. Then you got to get the back pay. But first you got to survive that whole year with no money. So it's very tedious and it's a very patient thing. And
Yeah.
it's wild. You really do need help, and I'm glad we have us to help
Right.
those that
I,
don't have to go through those things. I just had to share that. That's phenomenal, and I
I
know
think
exactly where you're located.
we have 4 satellite offices down here in the South. There's Carbondale, Cairo,
Yeah,
Vienna, and Harrisburg. We serve the lower
yeah,
13 below Mount Vernon. So we're kind of starting services in Benton for our Southern Illinois folks. But
yeah.
one of the important things that I also like to remind people is that those contingency lawyers. Typically, a lawyer isn't going to take your case for disability law unless they know they're going to win it, because they're paid on contingency. So
All
they
right.
are paying to file the court dockets. They are paying to get you in front of that judge. So
Yeah,
when my consumer with her, 24-hour continuous oxygen, her complex lung disease post-COVID, when I could get her set up with a lawyer and they accepted her case, I was like, Woo!
And then you got to think about
Actually,
the two sets of doctors, your doctor and their doctor.
right. Well,
You
and
get
their
it too.
doctor.
Oh,
I,
wow.
it's an interesting road. I walked in and I was like, this man's still alive enough to practice medicine. Are we sure about that? Because he
Yeah.
was probably 90 years old and like,
And study.
and I was shocked. And he didn't acknowledge long COVID at all. He kind of like laughed it off and was like, ha ha ha. And I'm like, she's 24 hours oxygenated, dude. She spent 61 days on a ventilator. Like
Yeah.
there's nothing funny about it. But yeah, you know, when we were able to do that, she actually texted me the day after Christmas of 20, I want to say 2020. God, the years are blending together, y'all. I don't know where I've been the past 5 years, but it's just kind of been a constant. But she texted me the day after Christmas, and I just remember bawling because I was so happy to know that she was going to be safe. We were going to be able to like locate some housing, be able to help her with her livelihoods. I was traveling to Harrisburg, which is almost an hour and 20 minutes away from my office here in Carbondale, to assist her weekly, just so that we could, you know, fill in those gaps in the meantime. But this is something that, you know, as we are all organizations who want the betterment of people, I really want to remind people Centers for Independent Living exists for disabilities, for individuals affected by disability, in order to keep them in the community. We're not going to be someone who's going to say, hey, we can't do that. How about you look at a nursing home? How about you look at a skilled nursing facility? How about we get you into an assisted living? We want people to remain in the community because we believe disabled people have value in life, and we also value that life. So I just wanted to throw that out there. If anybody needs any information about Centers for Independent Living, please be sure to throw me an email or something. I can always give you guys where yours is. I also, for the state of Illinois, included the INCIL link. Don't really love the acronym, but it's incil.org. And that will give you a map of the state of Illinois. You can hit your county and it will tell you what Center for Independent Living services your particular region. And if you guys need anything, I've dropped my email in there.
Thank you so much, Beth. And feel free if you're able, I'm trying to I'm saving the chat, but if you also have any resources that you want to email to me, happy
Sure.
to include those. I know Summer just indicated she will share a copy of her slides and some resources. So yes, feel free to get that over to me, and I will be sending that out along with our recording of today's session for everyone to have and hopefully be able to refer back to. I'm sorry that I need to cut us short, but we are past 1 o'clock, so I want to be respectful of everyone's time. I want to say thanks again for being here. Thank you, Summer, for a wonderful presentation. We really, really appreciate you. Please enjoy the rest of the year. We will not meet in December, but we will see you all back in January. Take care.
Bye, y'all. Have a good one.
Bye. Thank you.